Why are Ewing sarcoma relapsed cases hard to treat? Ewing sarcoma is a challenging cancer, especially when it relapses. So, why are relapsed cases so hard to treat? The prognosis for these patients is often poor, and there is no standard treatment that guarantees success. Several factors contribute to this difficulty. First, the biology of relapsed Ewing sarcoma is aggressive. Cancer cells can develop resistance to chemotherapy, meaning that the drugs that worked initially may no longer be effective. When patients do not respond to salvage chemotherapy, their survival rates drop significantly. Some studies show that non-responders have a 5-year survival rate of 0%. This resistance makes controlling the disease after relapse particularly tough. Another factor is the duration of the first remission. Patients who relapse soon after their initial treatment tend to have worse outcomes. If someone relapses during or shortly after their first-line therapy, it usually indicates a more aggressive or resistant form of the disease. This shorter first remission period is linked to poorer survival rates. Effective treatment options for relapsed Ewing sarcoma are also limited. While high-dose chemotherapy combined with autologous stem cell transplantation can help some patients, the best chemotherapy regimens for relapsed cases are still being studied. Various combinations have shown some promise, but no single approach has proven to be the best. Treatment often includes surgery and radiotherapy, but these methods may not be feasible or curative for many patients. The toxicity of salvage therapies is another concern. These treatments can lead to significant physical and psychological side effects. Since many of these therapies are not curative, balancing aggressive treatment with quality of life is a major challenge, especially for adolescents and young adults who are the primary group affected by this cancer. Ewing sarcoma itself is rare, and relapsed cases are even less common. This rarity limits the number of large-scale clinical trials available. Many oncologists may have limited experience managing relapsed cases, making collaborative research essential yet challenging. The lack of consensus on the best treatment reflects gaps in knowledge and the urgent need for further clinical trials. Finally, the overall survival statistics for relapsed Ewing sarcoma are concerning. The 5-year survival rate is around 13%, and it drops to about 7% for those who relapse within 2 years of their initial diagnosis. If the disease has metastasized at the time of relapse, the prognosis worsens further, often leading to survival rates below 30%. In summary, relapsed Ewing sarcoma is difficult to treat due to its aggressive nature, chemoresistance, limited effective therapies, treatment toxicity, and the rarity of the disease. Current management focuses on chemotherapy, surgery, radiotherapy, and stem cell transplantation when possible, but outcomes remain as poor. Enrollment in clinical trials is strongly encouraged to explore new therapies and improve understanding of this challenging condition. Always consult healthcare professionals for personalized medical advice.